My name is Dr. Scott McPherson. I'm from the Department of Ophthalmology and Visual Neurosciences at the University of Minnesota in Minneapolis, Minnesota. My project is looking at the role of zinc in both the pathogenesis and the prevention of age-related macular degeneration. Well, we're trying to develop a model system whereby we can study why zinc might be pathogenic in AMD and also why it might be preventative in AMD. Zinc has been proposed to have beneficial effects for AMD patients, and it is often used in supplements that are recommended by the ARAD study. But on the other hand, there are evidence that is also involved in the pathogenesis of AMD, in that its translocation from structures in the retina, such as Bruch's membrane and the choroid, into subretinal epithelial deposits, which we see as drusen, suggest that it is, in fact, could be contributing to the pathogenesis of AMD. However, there are not any good animal models to which to evaluate this on right now. And so that is what I'm trying to do, is I'm trying to develop a good animal model in which to evaluate how zinc might be both pathogenic in AMD and how it might also have a role in preventing AMD. Well, eventually our goal would be to have a nice, easy assay that's based on fluorescent detection of zinc. So in other words, if you have zinc in drusen, well, I should back up and say that subretinal epithelial deposits, drusen, are loaded with zinc. And we want to take advantage of that to show that by having a sensitive fluorescent assay, we can pick up these drusen deposits when they're really, really tiny, before they can be seen by any sort of current examination that you might get from an optometrist or an ophthalmologist. And that way, therapeutic interventions could be started at a much earlier age. You could start taking antioxidants, you could start taking your vitamin supplements, you could take zinc supplements, you can even put on your sunglasses when you go outside, so anything that you could use to limit the progression of AMD. So eventually we'd like to have a nice, easy assay that an optometrist or an ophthalmologist could use in an office during a routine examination that say, yes, you're starting to develop these drusen deposits, they're very small, but you should start taking steps to limit your exposure to sunlight, or make changes in your diet, or stop smoking, or whatever risk factor that is known to be associated with AMD you could make a change in. Basically a four-step process. The first step has been to evaluate fluorescent stains for zinc, which we have completed. The second step is to test mouse models to evaluate whether they'd make good in vivo models, and we have completed that. And so our next step, which we are just about to start, is now trying to figure out how we can detect the subretinal epithelial deposits, the drusen, in our mouse models in an in vivo setting. And then after that's completed, and if it's successful, then we will move that into human studies.